Dr. Choma, thank you so much. I learned a lot from the session, but I have two questions. Do we, as women, how can we locally detect that we've been infected with this virus, and how also can we prevent it early as a woman without going to the hospital? And secondly, the question has to do with men. Do men do screening for this virus?
Thank you so much, Florence, for the question. That's a very pertinent question.
Yeah.
So, Dr. Zobo, answer Florence's question.
Thank you so much, Florence. That's a very vital question. I'll answer it this way. One of the When you start seeing symptoms
Yeah.
that are suggestive of cervical cancer, it means it has become advanced.
Yeah.
So I wouldn't say, one of the things you should never rely on is the symptoms. You
Yeah.
shouldn't say, "Oh, I'm not having
You see,
symptoms yet.
perfect.
I'm waiting for symptoms." No, we don't want you to get to that stage, because when you start having the symptoms like the low abdominal pain, the smelly discharge,
Discharges.
clumpy, smelly blood, irregular bleeding, it's weight loss, it means you are already there.
It's really
And we
advanced.
are trying to stop you from even having the cancer itself. So
Yeah.
that's why we encourage early detection and HPV vaccination. So by getting vaccinated and by getting screened
Screening.
regularly, you're able to know that, oh, I am safe for the next 3 to 5 years. Nothing was
Exactly.
found, or oh, there were some changes, some abnormal changes that need to be further
Examined.
tested or
Yeah.
examined, or this has been confirmed that it's a precancerous stage. Let's take it out.
Mhm.
And then once you're done and you're screened again and you're found free from it, you're living your life to the next appointment date. By doing
Yeah.
that, you're keeping yourself safe, and you're not even getting to that point at all. So you ask a good question, and that's the reply.
Yeah. Okay. Then her second questions about men. Should men just go and do a screening for HPV to know if they are even infected or not?
Yeah. So the thing about HPV is that you swab where you play. That's how we say it.
That's
Yeah.
a good one.
You swab where you play. That's it. Um, so if you're having anal sex, you go and swab. Oral sex, you swab.
So,
Vaginal sex, you swab.
yeah.
So that's it. HPV testing can be done, but then you swab where you play. So if the man is having heterosexual relations, there is it's not a blood test. For the women, yeah, you need to get tested by, there's self-testing now for HPV. You
Okay.
swab, and then you get tested for HPV. That's another method. Besides the pap smears, the VIA, HPV testing is also one of the methods. Yeah.
Okay.
Thank you, Dr. Zobo. I just have two questions. The first one is, you say that HPV is the first reason why women are getting this disease. So I want to know, as a man, how can we behave to protect our wives? Because if you give this virus to them, it can be like the cause of this cancer. As a man, how can we behave to protect our wives? That's the first question. The second one, in your communication campaigns, do you target men? Because as they are also part of the problem, do you target them? Do they have those kind of information in order for them to like behave the good way, so that they can be also active fighters against this cervical cancer? Thank you.
Thank you, Farouk, for your question. It shows that you're a proactive man, and it shows
Yeah.
that you are involved. And that's what we need. We need more
We
men
need more
involved.
men. Yeah.
One thing that we need to understand is, when it comes to women's health, it's both the women and everybody associated with their lives, everybody that has a role to play in their lives.
Yeah.
And that strongly includes the men.
Mhm.
So the men have a huge role to play. Firstly, vaccination. You
Yeah.
get vaccinated if you're within the age. Get your boys vaccinated. Get your children vaccinated.
Vaccinated.
Encourage your women to get vaccinated. Encourage your women to get screened. And then you take personal responsibility for their health. For anyone who you're in sexual relations with,
Yeah.
understand that you owe them health too.
Mm-hmm.
So if you're having multiple sexual partners, you're not helping her.
Yeah.
So you need to be
Absolutely.
faithful. You need to also spread the word out there for people to know what the risk factors are, to know how to prevent cervical cancer.
Yeah.
Organize trainings in the meetings, call facilitators to speak, share content that has to do with education around this topic. So it's a personal responsibility for everyone. Men have an active role to play. When women need to go to get screened, remind them, encourage them. Don't tell them to sit back home.
Yeah.
Oh, where are you going? No, encourage them to get
Yeah.
screened. It's a collective responsibility, because they say the nation is as healthy as their women, because women have a vital role to play in the family front. And when she's unhealthy, everybody is unhealthy.
Very true, very true. Because even the offspring she's going to bring is through her. So if
Yeah.
she's infected, therefore the next generation
Yes, is
is
affected.
affected.
Yes.
So that's why the men have to help the women. You, during your campaigns, do you involve men during this program?
I mean, it's obvious. We do. We
Yeah.
involve men actively in the volunteer stage, in our community engagements, even on the screening days. When we're educating, the men are there. We don't just
Good.
educate the women. We don't just target the women. We target the women and their men,
Yeah,
the adolescents who are the next generation. It's a collective fight. So they need to be a key part, because men are also very influential in the
Yeah.
family and in
Yeah.
society. And so we need to leverage that. So yeah, we do. Thank you so much, Barry, for asking.
Thank you so much, everyone, for the questions. And if you have any other questions, any worry, just drop it on the comment sections and we're going to get to you. And we're just going to get one last word from Dr. Zobo, and she's going to tell us how we can get to her, because I know after this, many of you will start asking, oh, where can we find her? So we're going to get that from her now. So can you give us the last words to your audience?
Okay. I mean, if you watched this far, it means that you are really, really proactive about your health.
Yeah.
So I want to say kudos to you. Spread the word. Our health is our collective responsibility.
Exactly.
And remember, it's never too cliche to say that health is wealth. I know you can't hear enough of it. It's the truth.
It is.
It is the truth. I think that's what I'll leave you with. Just keep the faith, keep pushing, and do what you have to do. I am Dr. Zobo across all social media handles, on Twitter, on Instagram, on Threads, TikTok, at Dr. Zobo, DRZOBO. It will be on the screen.
Yeah.
I have a foundation, Smile With Me Foundation. So if you want to find out more information about what we do, you can check out both our website, smilewithmefoundation.org, or check us out on Instagram. If you want to reach us, we're an email away. Let's find out how we can collaborate with your organization to educate, to screen. And if you want to partner through donations, because we also offer these services to underserved communities, we're always available. Thank you so much, Dr. Noella, for having me.
Thank you so much, Dr. Sheva. It's a privilege to have you on our show today. Thank you very much, and God bless you. God bless the work you're doing.
Thank you.
And continue serving our population, saving those girls' life, because it's the generation of tomorrow. Thank you very much.
Thank you so much.
Bye.